Going for a breast screening follow-up appointment.
Some women need more tests before a breast screening results can be given. This may make you feel anxious. Being called back does not necessarily mean there's something wrong. There are two different types of letters you may receive asking you to come back for more tests. Sometimes the picture taken of inside your breasts are not very clear and need to be done again. This will be called a technical repeat in your letter, and you will need to have another mammogram. You later will tell you where you can go for your appointment. You can bring someone with you for support, and if you are worried, connect your local learning disability team. The other type of letter you can receive is a recall assessment. Sometimes the mammogram do not show enough information, and another assessment is needed. The appointment is an extra check, and for most women, nothing will be found. If you are invited to come back to the clinic, the reason will be explained to you in more detail when you come in. Please remember you can bring someone with you for support, and you can also connect your learning disability team. If you need any questions of reasonable adjustments, such as a quiet waiting area, you can speak to a best clear nurse. You will find their contact number on your appointment letter.
What will happen when you go back?
At the breast clinic, you will be seen by a doctor or nurse. They will explain to you why you have been invited back. You might have to wait at your clinic for 2 to 4 hours to have all the tests you need, so it's a good idea to bring someone with you to keep you company. You might be asked some questions before you are seen by a doctor or nurse, such as family member had any breast problems, what medication you are taking.
What type of tests might you have at the clinic?
You can bring somebody with you for support and company. You might have another mammogram, an ultrasound scan, or a breast biopsy. You may have more than one test during your visit. Not everyone will need all the tests. Don't worry if you don't have them all. You may have another mammogram in order to show half your breast in more detail. Please see other breast screen videos and what a mammogram is. You might want to have a breast exam. During your breast exam, the doctor or nurse will want to check both of your breasts when you are sitting and when you are lying down. They'll be feeling any changes or lumps in your breasts or armpits where your glands are. These glands are called lymph nodes. Sometimes cancer can be found there. An ultrasound scan gives a picture of an inside of your breast. It's usually done at the same time as your breast examination. You'll be asked to take off your clothes from the top half of your body. You lie down on the couch with the arm above your head. The person that's doing the scan will put gel in your breast, which will be cold. They move a small device over your breast, which will see the inside, which will show on the screen. An ultrasound scan should not be painful. Will only take a few minutes.
Your doctor or nurse might want to do a breast biopsy. The doctor will take a small piece of breast tissue or a sample of cells from your breast so they can take it away and look at it to see if it contains cancer cells. There are different ways of doing a biopsy. Your doctor or nurse will explain the type you will have. If a biopsy is taken, you will be given a small amount of local anaesthetic using a needle. This means that you will be awake, but the breast area will be numb, so you will not feel anything. A few samples may be taken using a different needle. You will be invited back in around 2 weeks to discuss the results of the biopsy with a doctor and plan any further tests or treatment.
Getting your results.
The information makes you overwhelming or scary. Most women do come to your clinic do not have breast cancer. This why it's just to have a friend or somebody from your family with you. Doesn't ask any questions you may have. A doctor or breast care nurse at the clinic will give you the results of your test. You may get your results on the same day. You may have to wait a week or more. The doctor or nurse will explain what will happen. Your results may come back as no problem seen, which means further tests did not find a problem. There will be no more treatment at this time. If you have no problems of seeing the results, you're aged to 15 to 17. You'll be invited back for weekend screening. Again in 3 years' time. If you're over 71, you can ask your GP for screening every 3 years or refer yourself from your breast screen service. A small women might be called back with early review after 6 to 12 months. Some results may show tended. These changes are benign condition. These changes are not cancer. The doctor will tell you if you need further treatment. Sometimes it can be hard to understand. It's a big idea to have a friendly or family member to help explain to you. This pet show you have cancer. The breast team will help with your care.
You will usually meet a breast surgeon and a breast care nurse who will talk to you about what will happen next. When breast cancer is found early, it is easier to treat successfully. If you are worried or have any questions, you can get help from your carers or contact your local learning disability team. You can also call Breast Cancer Cares Helpline on 0808 800 6000.
I'm a learning disability nurse. We have learning disability nurses in the community and in the hospital. My job is to support you and enable reasonable adjustments within healthcare. I will speak to you and find out what you would like me to do to make sure your appointment or stay goes smoothly. There will be a nurse like me in all hospitals. If you have an appointment or need to stay in hospital, please ask for the learning disability nurse.